and welcome to YHELPtalk with Taylor. Today we are with Dr. Tanikka Fevrier, a pediatrician discussing teen health and wellness. Hi.
Hey guys.
So tell us about yourself and your position.
So I'm a pediatrician, and I see children from ages birth to 17 years old, making sure that they're well, healthy, from birth until teenage years.
Why should teens prioritize their health?
Truly important to prioritize health because we're growing. We want to make sure that we give our body the things that it needs on a day-to-day basis, on a regular basis, and then for us to thrive and flourish in school, in sports, activities. Definitely how we maintain and stay active and healthy is all a part of our health.
What can teens do to balance their mental and physical health?
Great question, Taylor. It's really hard because teens go through a lot. There's a lot of different schedulings that you have, a lot of changes that are going on in your body. So it is hard to balance, but it's important to balance for a number of reasons. So your health means that you're able to thrive and able to be able to do your best. So really important for you to stay active. That's part of your physical health. And it's also important for you to stay mentally healthy in order to make sure that you are preparing yourself, you're able to focus, you're able to do all of those things that you need in order to stay healthy in general.
Do you think that mental health is just as important as physical health?
1000% important. It's just as important as your physical health. Your brain is what kind of coordinates everything and does everything for your body, right? And so when you are mentally healthy, you're able to have positive thoughts, positive thinking, which affects your mood. It gives you motivation, it gives you encouragement, which in turn helps motivate you physically. So that gives you that drive, that energy to be able to do those things, to be active in order to stay healthy physically. So it's all related, all important, just as important as physical health.
Do you have any tips for teens who might not like eating healthy or exercising?
Great question. It can be really challenging. There's some people who don't enjoy moving or physical activity, and some people just haven't found the right thing for them that motivates them to be active. But it's important to just start slow. You're not gonna set your mind to it or set a goal to be active and be healthy and then go run a 5K the next day if you haven't been physically active on a regular basis. So give yourself grace and know that it's gonna take time. No, it's not gonna happen overnight. But start slow. I'd say start with setting a goal of 10 minutes of physical activity, of actively moving each day. And then you'll be able to build on that. And it'll get better and better, and you'll be able to push yourself a little bit further each time. So start there. And then as far as the diet part of it, or eating healthy is what I like to call it, because I don't like dieting. No one should be dieting as a teen or as adults either. We want to create healthy food choices. We want to make sure we're creating healthy goals. So I encourage people to stay active, but also start slow with the changes in your food choices. Cut out the sugary drinks like your soda, your coffee, your tea, your energy drinks. All of those things can be your first step. You don't have to do it all at one time.
Do you think rest and sleep is important for teens? And if so, how much do you need?
Yes, so very, very important because our body rejuvenates overnight. As our body is sleeping and resting, all of our mind, our body, it's really just kind of recharging. So if you're not giving your body and your mind adequate time to rest, then you're not going to be at your full best. You're not going to be fully charged 100% each day. So most teens don't sleep enough, which also can be a problem with when we go to school. We feel foggy, we can't focus. Ideally, teens should be getting between 8 to 10 hours of sleep each night. I see your face, which most teens don't get because we are so busy. As teenagers, you guys have a full schedule. You're up late doing projects, you have practice for sports and band and all of those things. So it's all about time management, balancing that time as much as possible. But goals should be 8 to 10 hours each night.
I only get like 6, 7 on a good night.
And you probably feel the difference, right?
Yeah. What are some effects of teens engaging in drug or alcohol abuse?
So we know that illicit drugs and alcohol are not healthy for the body for anybody, right? And so these drugs are chemicals that affect the brain. The brain controls the body. So we have certain drugs can be uppers that you hear about, uppers or stimulants. They cause you to not to have a burst of energy sometimes, but then you end up crashing because your brain is overwhelmed and overloaded. Alcohol is more of a depressant, so it makes you slow, it makes you groggy, you're not motivated to do anything. So all of these are all things that counterbalance you being productive, you being able to do the things that you need to do, able to do the things that you want to do, because you're overloading your brain with things that are outside influences that no one needs.
What can a teen do if they have challenges with substance abuse?
So there are a lot of really good resources. The first step I would say is acknowledge that there may be an issue. If you're doing things where you feel like you have to sneak around, you know you would get in trouble with parents or with the law in school, or your grades are declining, those are all signs and red flags that there is a problem. And so admitting that there is an issue is great. The next step would be to confide in someone, like a friend, a parent, a teacher, a counselor, and they can always guide you and direct you in resources. There's online help for teens as well, and your pediatrician can always help you make that decision to seek help.
What should teens do if they're thinking about engaging in sex?
So it's really important to know what comes with that, right? So sex is, the purpose of it is procreation or creating another life. Most teens are not ready for that, right? No, most teens aren't ready for pregnancy. Most teens aren't ready for other things that come with that as well, like such as STIs or sexually transmitted infections. So knowing what comes with the act of that, knowing what the consequences or the things that can happen after engaging in sexual activity is really important. But we know that it's going to happen. So the next step is to take all of the necessary precautions to protect yourself and keep yourself safe, which means using protection, meaning condoms, birth control, and all of those things to keep yourself safe from pregnancy and sexually transmitted infections.
Do you have any advice about teens staying safe and healthy during the pandemic?
So this has been a rough time. This has been a big change in how we live life, how we socialize. You do want to make sure you take all of your necessary precautions. We are still in a pandemic. Although it seems like things are opening back up, we still want to take those necessary precautions to stay as safe as possible because we are still dealing with the virus. So continue to wash your hands, continue to wear your mask when you're in public places or in large crowds. Try to keep your gatherings small. All of those things that we've been talking about for over 2 years now to keep yourself as safe as possible. Finding alternative ways to stay social or interactive. I feel like teens are already ahead of the game with the social media, different apps that you have to do group things like Zoom or all of those different avenues to figure out how to navigate our different world right now. But the main thing is the bare necessities. Wash your hands, wear your mask, limit your gatherings as much as possible.
Well, that's all we have for this video. Thank you all for watching. And is there anything else you'd like to say to our audience before we go?
So I do want to encourage teens to make sure that you know that health is really important. If you're healthy now, you typically remain a healthy adult as you get older, and you kind of decrease your risk of having chronic illnesses like high blood pressure, diabetes, and high cholesterol. All of those things will play a role in your adult life. So if we make healthy habits now as a teenager, we tend to carry those through as an adult. And again, it doesn't happen overnight. You can set a goal, start out day one, but you don't have to think that everything is going to change overnight. Make those small changes, stick with it, make small goals, and you'll get there.
Okay, thank you all for watching. Bye.
Bye, guys.